In this video I'm going to share with you why shoulder pain keeps coming back and what you can do about it. If you suffer from shoulder pain that won't go away, you're not alone. And that's because according to clinical trials, the exercises and a lot of the things that medics and physios do aren't much help, while the two major causes and the treatment shown to work are ignored. And the main thing here is to give you the best possible resource to help you get better, so I'll go over those causes and the effective therapy, then give you some practical advice and self-therapy. If you need professional help, so you get the right help, I'll give you enough info to find someone suitable and discuss things with them in an informed manner. Now, the first overlooked cause of shoulder pain is myofascial trigger points, or trigger points for short. Now, they're those tender lumps in your muscles that therapists find, and they can cause pain either directly or indirectly. Now, the directly is obvious. You may have seen charts like this showing how they shoot pain. Now, the indirect way trigger points cause shoulder pain is by altering the movement of your shoulder joint, causing abnormal stress or pinching. Now, I'll explain that one. As these pics show, your shoulder joint has a large rounded surface sitting in the shoulder socket. Now, as it shows, when you lift your arm, the large rounded surface needs to rotate and slide down so the surfaces keep a good contact and don't pinch. Now, with such a big rounded bit sitting in a shallow socket, it's fairly unstable, so if left to itself it would easily slop around and cause damage. So you've got a team of short muscles that hold the rounded surface in the best position. As you move your arm, these short muscles need to work in a coordinated manner to keep that rounded surface exactly where it should be. Now, what happens though is trigger points cause muscles to be tight and not work properly. So if any of those muscles have trigger points in them, that means that the muscle can't do its job properly. So the movement loses coordination and the big rounded bit moves around in a less controlled way, and that gives you problems. Now, the first problem is that things can pinch, giving what we call the impingement syndrome. Now, this incidentally is probably the most common shoulder pain diagnosis medics make. Now, you can see in these pics that when the rounded bit is where it should be, there's enough space at the top. But if it's slightly up on where it should be, things get squashed. Also, if it's sitting properly, you get a nice even pressure spread all over the joint surfaces. But if it's poorly controlled movement, there might be uneven pressure or only a small part touching. Now, that makes it wear out faster, so over time you get degenerative or arthritic changes that you'll see in an x-ray. Now, lastly, when your shoulder joint is moving abnormally, parts often have to compensate or work in ways that they were not designed to, and they become overstressed, and over time these can become painful or are easily injured. Now, second overlooked cause of shoulder pain is having a head and shoulders forward posture like this person on the left. Now, let's show you why this is a problem. Now, this is a picture of an arm attached to a shoulder blade. Now, with normal posture, your arm normally hangs straight down, roughly in line with your shoulder blade. However, as this pic shows, with your head and shoulders forward, your arm hangs at a different angle to your shoulder blade, which places unusual stress on the muscles and tissues and makes things much more likely to pinch. Now, I'd like to do a quick demo to show you. So I'd like you just to sit up nice and straight, then raise your arms to your side. Now put your head and shoulders forward in the head and shoulders forward position and try and lift your shoulders. Now, you won't be able to bring your arms up as far and your shoulders will start to pinch. Now, seen before how trigger points are a big overlooked cause of shoulder pain, it should be no surprise that treating them is a very effective overlooked therapy. Now, it's been very successfully used in many clinical trials, so much so that a scientific review of 16 studies of shoulder pain found that trigger points were the most common cause and their treatment should be the #1 priority. Now, another scientific study concluded that if trigger points were not taken into consideration, they could perpetuate and aggravate the problem and make treatments ineffective. Now, studies show that only 21% of shoulder pain sufferers are better after 6 months. And the big reason is that this stuff is usually left out of medical journals. Now, instead, doctors are advised to use drugs and therapies that don't work. Now, why is that? Well, most sources of information for doctors rely on drug company funds. Now, if you don't get better, they sell more drugs. Now, this is a good stage to say that in this video I say a lot of things that, let's say, are a little bit different from what doctors would tell you or what you'd find on, say, the Mayo Clinic website. So I've got a companion article linked in the description with all the details and references. As I said, the main purpose of this video is to give you the best possible resource to help your shoulders get better. Now, to do that, I need to give you helpful information, but unfortunately I also need to make you aware of things that are not so helpful that you may already have heard that can be counterproductive. Now, the first is, with this information not in medical journals, doctors tend to look at secondary issues and the things they can see on scans. Now, what happens is, just say you've got some trigger points or your posture's not quite right and it's causing some stress and pinching in your shoulder. Now, the doctor will note that there's a bit of pinching and probably some inflammation and prescribe you rest and anti-inflammatory drugs. Now, if we take it a bit further, just say that it's been doing that for a while and it's caused some damage, and that damage showing up on scans or x-rays. Now, your doctor will tell you that this damage is the problem. Now, it's not the underlying problem though. The thing is though, if you fix the underlying problem early enough, your body will heal. But if you leave it long enough, all these secondary problems will develop. Now, the next harmful bit of information is that you can fix these problems with exercise. Now, the neurology and biomechanics are complex, but the concept is really simple. Your nervous system controls all these things, and if something is wrong, like trigger points causing a muscle not to work properly, or your posture causing angles to be wrong, your nervous system makes changes to compensate. Now, the thing is that exercises can't override this. Now, scientists have proved that. Now, if you do exercises, that ball in your shoulder joint is not going to magically become coordinated again. Now, it's going to keep moving in the same uncontrolled way. Now, all your exercise will do is damage your shoulder joints quicker. Now, that's the reason why they do trials of these exercises. The results usually aren't very good, and sometimes it makes it worse. But they still prescribe the things. Anyway, that's enough about what not to do. Let's give you some practical advice. Now, please keep in mind though that I can't give you specific information to people that haven't personally examined. So consider this as general information to be discussed with a professional familiar with your own needs. As the scientist I mentioned said, trigger points should be the first thing to think of. Now, we've got a comprehensive guide on our website called Massage and Trigger Point Therapy for Shoulder Pain with Self-Help Options. Now, I'll link that in the description. It gives you how to find trigger points, several effective home therapy options, and a list of muscles that can be potentially involved with specific instructions for each. It's a very good guide. And the other thing you should be doing straight away is stopping or at least limiting any activities that are aggravating a condition. Now, you do that temporarily while your shoulder settles down. Now, this includes any exercises that you may have been prescribed. Now, the next thing is, if you've got a head and shoulder forward posture like this person on the left, that'll need to be sorted. Now, just be wary though that medical solutions such as exercises, taping, braces and advice are just as bad as their shoulder therapies. So I'll link in the description article you can read that covers why you get these problems and the best way to handle it. If your shoulder's still not settling down properly, there's a couple of other issues that need to be looked at. Now, the first is that there are often issues within the shoulders and other joints that inhibit them from working properly. The simplest way is to think of these as adhesions or restrictions stopping the joint surfaces from sliding on each other. Now, you need a professional to have that checked out. Now, I'll link an article in the description with more information about these and how they're treated. Now, the last thing is you could have some sort of medical issue which needs to be looked at. Now, I mentioned that a lot of these are secondary to functional issues that I've discussed, but there can be other causes such as injuries. Anyway, Look, I hope you found this useful. Now, if you have any questions or comments, please leave them in the comments. Hey, thanks very much for watching. It has been most appreciated.